The systematic obstruction of mental health and psychosocial support (MHPSS) services in Gaza exacerbates the psychological trauma experienced by its residents. This obstruction, coupled with ongoing conflict, creates conditions that may align with genocidal intent under international law. The lack of access to essential mental health services significantly contributes to the deterioration of community well-being. The systematic obstruction of mental health and psychosocial support (MHPSS) services in Gaza is a critical issue. Legal analysis under Article 2B of the Genocide Convention highlights the severity of these actions. Mixed methods analysis of psychosocial data reveals the transformation of humanitarian care under siege, with psychological harm patterns emerging from continuous bombardment and blockade. The systematic obstruction of mental health and psychosocial support services in Gaza from October 2023 to August 2025 has exacerbated psychological harm. With 730,000 displaced, including over 500,000 children, the blockade's 18-year history has entrenched trauma. Limited legal analysis exists on mental health and psychosocial support obstruction as evidence of serious mental harm under international law, challenging documentation efforts. The humanitarian significance is profound, with over 730,000 displaced individuals, including 500,000 children, facing systematic psychological harm. Legally, we explore obstruction as evidence under Article 2B of the Genocide Convention. Key research questions include credibility construction in care under siege, trust mediation, and defining systematic obstruction. The expected impact is establishing mental health protection as a human right in conflict zones. Previous trauma studies like Kuta et al. 2012 and humanitarian mental health and psychosocial support frameworks such as World Health Organization and Interagency Standing Committee guidelines highlight gaps in legal analyses of psychological harm. Our work addresses these by integrating psychosocial data with legal analysis under Article 2B, overcoming limitations like insufficient longitudinal data and lack of mixed methods evidence triangulation. Our methodology employs a mixed methods concurrent triangulation design. We analyze United Nations Relief and Works Agency data alongside corroborating sources to ensure comprehensive insights. This approach integrates quantitative and qualitative data, enhancing the robustness of our findings and providing a holistic understanding of the psychosocial and legal dimensions in conflict zones. Our research employs a mixed methods design, integrating quantitative and qualitative data. We primarily analyze United Nations Relief and Works Agency Situation Reports from October 2023 to August 2025, covering 320,035 psychosocial support sessions and 334,148 social work interventions. Corroborating sources include World Health Organization reports and practitioner testimonies, utilizing R statistical package for the social sciences, and qualitative coding frameworks for analysis. The study spans October 2023 to August 2025, focusing on Gaza under 18 years of blockade. It relies on United Nations Relief and Works Agency reports, applying Article 22B of the Genocide Convention as an analytical lens. The assumption is that systematic obstruction is evident through service delivery patterns and institutional targeting. Our analytical framework integrates data from United Nations Relief and Works Agency reports and humanitarian sources. We employ quantitative analysis to examine session patterns and beneficiary profiles, while qualitative insights are drawn from practitioner testimonies and lived experiences. Legal analysis applies Article 2B criteria, ensuring robust triangulation through cross-validation across diverse data sources. Analyzing 320,035 psychosocial support sessions reveals significant quantitative patterns and qualitative insights. These sessions provide a comprehensive understanding of service delivery, highlighting trends and beneficiary experiences. The data underscores the importance of tailored interventions and the need for continuous evaluation to enhance support effectiveness. Analyzing service delivery trends, we observe a steady increase in psychosocial support sessions from October 2023 to August 2025. Peaks occur in April and October each year, suggesting seasonal demand fluctuations. This data highlights the growing need for psychosocial support, emphasizing the importance of resource allocation to meet these demands effectively. Children, comprising 58% of sessions, face trauma and developmental issues due to school closures. Women and girls, at 27%, endure gender-based violence and maternal stress. Adult men, 12%, struggle with depression and aggression from livelihood loss. The elderly and disabled, 3%, face mobility challenges and chronic condition exacerbation. Systematic obstruction patterns severely impact service delivery. A 98% demand increase contrasts with only 45% capacity. Infrastructure targeting has damaged 72% of health facilities. Aid restrictions led to an 85% reduction in mental health and psychosocial support resources. Worker targeting resulted in 142 health worker casualties. Institutional collapse leaves only 3 of 22 mental health centers operational. Credibility and trust in Gaza's mental health services emerge from shared vulnerability and continuity of care during crises. Practitioners' risk-taking enhances community legitimacy, while informal networks and cultural rituals replace formal systems. Schools as shelters and mourning rituals foster therapeutic spaces, emphasizing lived solidarity over institutional authority. The application of Article 2b of the Genocide Convention highlights the systematic obstruction of mental health and psychosocial support services in Gaza. With 320,035 documented cases of psychological trauma, the targeting of health infrastructure and workers underscores the intent to cause serious mental harm to the Palestinian national group, meeting the criteria for genocide. Our study provides a robust empirical evidence base, analyzing 320,035 psychosocial sessions to reveal systematic psychological harm patterns. It pioneers the legal framework application, showing mental health and psychosocial support obstruction as serious mental harm under Article 2b. Humanitarian dynamics are documented through shared vulnerability, and trust mechanisms are identified via transformed schools, cultural idioms, and collective rituals. The study's limitations include its end date in August 2025, leaving long-term impacts uncertain. Data relies on institutional reports during conflict, posing challenges. Future research should focus on longitudinal studies of intergenerational trauma and comparative analyses with other conflict zones. Developing protocols for mental health protection as human rights is essential. Systematic obstruction of mental health services in Gaza constitutes serious mental harm under international law. Credibility in humanitarian care stems from shared vulnerability, not authority. Trust is built through cultural resilience and transformed spaces. Recognizing mental health protection as a non-derogable human right in conflict is essential. Key references include the United Nations Relief and Works Agency's Gaza Emergency Response Report and the World Health Organization's Health Cluster Bulletin, both from 2025. The Lancet Psychiatry article by Kuta et al. 2012 explores Gaza children's mental health. The Genocide Convention's Article 2b and Mental Health and Psychosocial Support Guidelines by the International Association of Schools of Social Work provide legal frameworks. Dubois 2024 discusses ethical witnessing in crises. Thank you for your attention. For further inquiries, please contact mduboisinnovationinstitute.edu. Access the project archive at github.com/MHPSS Gaza Study.